MSN residents, I'm so glad you two could join us today. I know that you have both worked with childhood leukemia patients, so I want you both to be actively involved in today's learning experience. If you look at your handout right in front of you, you will see the learning objectives for today. By the end of this learning experience, the learner will accurately be able to summarize the pathophysiology of childhood leukemia in his or her own words. The learner will also be able to identify the two major criteria used to classify childhood leukemia. The learner will be able to identify two concepts related to leukemia and state how they relate to each other. So let's begin by discussing what leukemia is. Does anyone have any idea or a definition they'd like to share?
Yes, it's the malignancy of the blood and blood-forming organ.
Okay, perfect. Malignancy of blood. Perfect. Anyone else have a definition?
Right.
Yes.
There's a malignant transformation, I think, of the progenitor cells in the bone marrow.
Yeah, that's actually true. So what's happening in the bone marrow?
Well, bone marrow is full of the immature cells that fail to mature, so they can't do the job of the normal cells.
Perfect. That's a great explanation of it, Dina. So what are the normal cells that are present in, so we'll put it here. So you said immature cells. That's important to know. Cells crowd. And we'll use BM for bone marrow. So the immature cells crowd the bone marrow. So what are the normal cells that are usually present in the bone marrow?
They're red blood cells, white blood cells, and platelets.
Okay, perfect. So if why are they not able to make these normal cells?
I think it's because the malignant cells are always dividing and crowding up the bone marrow.
Oh, yeah.
Right? So that means there's not enough room to leave for the normal cells to be made, right?
That's exactly right. So because you can't make these healthy normal cells as you would, what symptoms or what signs would you see in a patient newly diagnosed with leukemia?
Paleness.
Okay, pale. And why would they be pale?
It's because of the anemia.
Okay, perfect.
Petechiae.
Okay.
Because of the low platelets.
Okay.
Tachycardia.
Yeah.
Also because of the anemia as well. What else?
They would have like fevers.
Oh yeah.
Because they don't have the white cells. They're neutropenic.
Okay, perfect. And tacky. That's really good job, guys. So, perfect. So since we have listed the signs and symptoms of leukemia, and that, now that we know what's happening in the bone marrow and how leukemia kind of occurs, can anyone tell me the two bone marrow progenitor cells that leukemias result from?
I think it's the myeloid and the lymphoid.
That's right. So the cells from the bone marrow usually begin with a pluripotent stem cell. Which then go into the lymphoid and the myeloid progenitor cells. So leukemia can be classified by the cell lineage. How else can leukemia be classified by?
I think it's also the onset.
Right, that's correct. Wow, you guys have been learning a lot on the floor, huh?
Yep.
Okay, perfect. So what type of onset do you usually experience with leukemia?
Acute.
Acute. Okay, so that would be if the patient has a sudden onset, right?
Yes, correct.
And then what's the other type of onset we would expect?
Chronic.
Chronic, yes.
So it'd be like a gradual.
Exactly. Perfect. So since we've gone over a brief overview of leukemia, let's talk about concepts that relate to leukemia. Kind of think of concepts that you would include in a nursing care plan.
Risk for infection.
Okay, and that would be why?
Because their white cells go down.
Perfect. Anything else?
One would be nutrition.
Nutrition. Okay.
Anxiety?
Anxiety, that's a very good one. Very common for both the children and parents to experience anxiety with this diagnosis, of course.
And they'd be fatigued and weak.
Fatigue and weak, very true.
And also, I guess, pain from like the infiltrates and through all the procedures that they go through.
That's true. So, can you guys tell me how these concepts could interrelate with each other?
Well, looks like nutrition and infection can relate with each other. In a sense that the family needs to be educated as to what they should feed the patients so that they don't get infection.
Right.
And how to properly wash fruits and vegetables, as well as reinforcing the importance of washing their hands before preparing food for the patient.
Right. Very good, Vina.
Anxiety, fatigue, because the parents are always, and patients as well, might be so anxious all the time. They might just be tired from all that anxiety.
Perfect.
It's like a round circle.
It is. Just keeps going. Does pain or anything else relate to each other?
Pain and
Weakness.
Weakness. Yeah, they could be weak from all the pain that they're having.
Yeah.
Yeah. So those are just a few of the concepts that I want you guys to think about as you take care of patients with leukemia. And now you can kind of describe to them what's going on so that they can better understand it. Thank you guys so much for joining me today, and I hope you learned a lot.
Thank you.
Thank you.